Now more look into how the social cash transfer system sort of fit in with the official development agency's agenda. And our first keynote speaker this afternoon is Lars Johansson from Sida. He works with the Swedish Embassy. He's based in Kigali, Rwanda, and will give us an example from Rwanda, Rwanda being one of the countries who have managed what the US has not managed, a social security system for every citizen at the cost of $2 per year, something that politicians in Rwanda will tell you very proudly. So please, the floor is yours.
Thank you very much for being invited here and getting the opportunity to talk about social protection in Rwanda. This is Sarah Nirabahinde. Some of you might recognize this photo. It's taken by Andreas Karlsson, a Swedish photographer, when he and a journalist was in Rwanda in May, making interviews about social protection. It was published 16th of July in Sida and Svenska, together with an article. I had the opportunity to sit in on the interview that was performed in a village some 15-20 minutes south of Kigali city. We spent the whole afternoon talking to beneficiaries in this village, and Sarah was one of them. And the journalist asked her about the program, how it worked, what kind of services she got from it, etc. And ended the interview by asking her, how has it changed your life? What have it implied for you? And this brilliant woman, Sarah, she looked at us as we were idiots, and she said, look at me, look at my hair, look at my clothes, can't you see? For her, it was quite obvious what had changed, and she thought it ought to be obvious for us as well. I can tell you about another woman, Patricia, that has also been part of the social protection program in Rwanda. She lives in Rubavu districts in northwestern part of Rwanda. She combined 3 different instruments, social protection instruments in Rwanda to make a difference to her situation. 2 years ago she was very poor. She is handicapped. She has 1 artificial leg. And she was considered to be eligible for VUP, the social protection program that I will talk more about during this 15 minutes. It's a cash transfer for the poorest that can't work. So she got a monthly payment of 7,500 Rwanda franc, which is about $12. And she thought that, okay, now I can do something. Now I have some space, and she decided she wanted to be a tailor. She enrolled in a course for becoming a tailor. It was a rather expensive course. It costed around $170. But she went to the municipality, and they had a social security fund, and they agreed to pay 40% of the course expenses, and the rest she could eventually pay from the direct support monthly payments that she got. So she educated herself to become a tailor, and in the end of the course she took a loan from a microcredit scheme that is also part of the social protection program. She took a loan of approximately $120. She bought the Singer sewing machine and started to sew clothes, dresses, trousers, etc., and made about 1,000 Rwanda franc a month, a day, sorry, for this, which is $1.50, maybe a little bit more. She's put half of this money she earned in a savings account at Savings and Credit Cooperative in the municipality, and the rest she used to support her family. She has a daughter that goes to primary 1, and she is able to clothe her, etc., for the daughter to be able to go to the school. She puts food on the table, and she's able to pay for the health insurance for herself and for the daughter and other family members. This is two examples of women in Rwanda benefiting from the Vision Umurenge program, VUP. There are many. I could have many stories about women and men that have, in a similar way, benefited from the program and changed their situations. And there are, of course, other stories as well. People that are frustrated, people that it doesn't work so well for. But if you would go out in the countryside in Rwanda to villages and just randomly talk to people that live in this area where the program is implemented, you will hear quite a lot of these stories. They are not unique in any sense. Looking beyond the stories, looking at some numbers of this rather successful program. I don't have the numbers for this last financial year, but for the previous one, the numbers have not come out yet. But for Rwanda financial year 2010-11, 18,879 households got access to direct support. That's unconditional cash transfers to the households. More than 100,000 people participated in public work projects funded from this social protection program. And they constructed different things in this program. There was in total 302 projects they participated in. Over 50,000 borrowers got access to microcredits. It's quite impressive numbers. The program started only in 2008, the first component. It was a public works program. 2009, the direct support program started, and as late as in 2010, in March, the first credit of the microcredit scheme was disbursed. We also have the quite recent data from a countrywide household survey, and it turns out that now poverty levels in Rwanda start to come down. Over the last 5 years, poverty headcount have reduced from 57% to 45%. Extreme poverty have come down from 36% to 24%. We cannot attribute all this, of course, to this program I'm talking about, because it started so late, and there are a lot of other things going on in Rwanda. Both on the social protection side, but more generally also on the development side. We have had quite strong growth in Rwanda over the last 5 to 10 years, on average 7% per year. The social protection sector in Rwanda is not only this Vision 2020 Umurenge program, but it's also a big program for genocide survivors after the genocide. It's another big program for demobilized ex-combatants. And there are many others. I haven't listed them here. It's a one cow per family program. It's numerous NGOs that is involved. This is just government programs. It's numerous NGOs involved, and I don't know all this program that is going on currently. So it's quite a lot going on, but these are the most dominant ones. Let me focus on VUP. Vision 2020 Umurenge program. Umurenge is an administrative unit in Rwanda, like municipality or small municipality. On average, it lives 25,000 people in every Umurenge in Rwanda. There are 416 umurenges, or municipalities, in Rwanda. Yes, VUP consists of three main components. It's a direct support component, the public works component or services, and the financial service, or microcredit scheme. And also training and sensitization is an important part of the whole program. Let me start with the direct support and explain a little bit about that. It's an unconditional cash grant, as I already said. It's an entitlement. It's your right to have it. If you have been identified as an eligible beneficiary of this program, you can complain if you don't get the money. It's your right to get them. It's for the poorest families with no member that can work in any public work programs or otherwise. The average payment to a family is $22 per month, but it varies because it's adjusted to family size. And 2/3 of the households receiving this are female-headed, which is a reflection of that female-headed households quite often are worse off than male-headed households. The public works program is also for the poorest families or households, but with those that has members that are able to work. Only one person per family or household can work in this program. The pay is $1.5 to $2 per day, and the mean number of days worked per household is 68 days per year. So you're not employed the full year, but maybe around 3 months or so. And about half of the participants are women. It's quite big targeting errors in this program. Out of everyone that participates in the program, 32% are people that should actually not participate in the program if it was implemented by the book. And out of everyone that should have been in the program, 43% never get to be included in the program, ends up outside. And there are a number of reasons for this. I can come back to that later on challenges. The most common projects that people work on in this program is making ditches, anti-erosive ditches, making terraces, roads and bridges, different types of agriculture projects. These first four account for more than 80% of all the projects that is done in this component. The financial services element of VUP, it's for the poorest plus some others. It's given to individuals, but also to groups and cooperatives. As an individual, you have to belong to poor categories of the population, but if a group or cooperative apply for a loan, it's enough that there are some members that belong to these poor categories. It can also be better off people that are members of the groups. The typical amount per person is between $100 and $170 US. The repayment is supposed to be done within 1 year, and it's an interest rate of 2%. It's not an annual interest rate, it's just a markup of the total amount. So it actually becomes cheaper if you delay the payments and more expensive if you pay early. Self-reported impacts, we don't have any good impact evaluation. We have evaluations and reviews of the different components, but it's mostly perceptional, self-reported impacts. But what people most commonly quote as an effect on the household's living situation is that they have increase their consumption, increased income, increased ability to pay for medical insurance, increased savings, and a number of other benefits as well that I don't list here. For the individual, it's significant that people so often quote this as a primary impact for themselves as person, that it increases the hope for the future and their self-confidence. You hear this not only for financial services, but for all the components. People might say things like, before I never would have thought of entering a bank, but now I have no problems to enter a bank institute. Something that I, before coming to Rwanda and working this, didn't even realize could be a problem, that you felt so intimidated by a formal financial institution that you didn't dare to enter the door even. This is a picture of targeting exercise. The targeting for VUP is done participatory at the village level. People themselves in the village decide who should be in the program and who should not. Actually, they don't decide directly who should be in the program. They decide who should be in which poverty category. They have a system in Rwanda called the UBD poverty categorization. So they categorize each household in the village in one of 6 different categories. So it's the first two. The first one is the poorest category, second poorest, etc. It's the first 2 categories that are eligible for direct support and for public works program. The difference being whether they have a household member that can work or not, that determines which program they end up in. It's members from category 1, 2, and 3 that are eligible for financial services. Plus, if they are in a group, then also other members. The target, can stay there a couple more seconds. The targeting is done every year, or retargeting. It's more thorough targeting exercise when they gather the whole community and draw poverty map, etc. That had been done like every 5th year or so. But every year it's a rapid update at the village level. And it's a huge, this is not only done in VUP villages, that does not cover the whole country yet, but it's actually done in every village in Rwanda, because not only VUP depends on this, but also the health insurance and other government instruments. So, for example, the health insurance that is famous, it's the payments there. Depends on your poverty status. The poorest people don't pay anything at all. Government covers their health insurance costs. Finally, let me go to funding and development partners. Our role. Currently, it's Sida, World Bank, DFID, EU, and UNICEF that support Rwanda on VUP and social protection. In the government-run programs, of course, there are many others as well in NGO sector. We are all coordinated around the social protection sector strategy, and there is an elaborate sector structure with a leadership team, technical subcommittees dealing with different areas like finance, for example, for social protection. There are specific meetings between development partners and the VP management teams every 40 days or so to get an update on results and have a dialogue on what is happening and problems coming up, etc. Every fall, like next week, it will be a backward-looking joint sector review with all partners, both government, bilateral and multilateral donors, and non-government organizations. It's another one in the spring, looking more forward, planning joint sector review. We try to use national system and coordinate as much as we can, but partners have different constraints from headquarters. But this is really important for Rwanda, and Rwanda is following up on our behavior. They make us make commitments every year on aid effectiveness indicators, how well we are aligned, to what extent we use Rwanda reporting systems, and etc. And they follow up this at the end of the year and see if we actually did what we said we were going to do, and we are made to shame if we don't deliver. It's quite aid-dependent. More than 50% of the VUP budget is provided by development partners. And results, coming back to what we have talked a little bit about before today on impact evaluation and results information. That is really important, both for domestic support within Rwanda for the social protection program, but also for us from Sida and development partners. Am I out of time? Okay, sorry.
And the problem is, or the circumstance, I should say, is that not our next, but our following speaker will be joining us on a video link from Washington, D.C. So I think in order for her not to have to sit and wait too long, we will try and keep on schedule, and then...
Yes. Okay, I will stop here. There are some challenges, as I guess you're aware of right now. We have a challenge in Rwanda where some donors have stopped dispersing aid, which is of course a big risk. We have talked some about predictability and long-term commitment, etc., and how development countries can deal with this when entering big-scale social protection programs. Thank you very much.
Thank you.